Now, cancer is one of those conditions that, if caught early, makes a huge difference because it is curative. Hi, I'm Rama. I'm a chest consultant. The topic I want to talk to you about is lung cancer. I have worked in lung cancer as one of two clinicians over the last 5 years and as a cancer lead for a shorter period of time. Now, cancer is one of those conditions that, if caught early, makes a huge difference because it is curative. So it is so important when people present with a background risk, but it doesn't have to be a smoker at all. But if you've got a cough or you've got phlegm with a bit of blood or any of these red flag symptoms, weight loss, night sweats, coughing up blood, cough which is longer than normal, chest pain, any of these things, it's so important to get reviewed and managed and investigated quickly because a curative outcome is present in at least 25% of people completely. You just surgically resect it and it's gone. However, in the rest of the types of patients, you can still achieve unbelievably good outcomes if you pick it up early or pick it up at a stage where you can treat, and there is a vast array of treatments available for patients with lung cancer now that is important to get started when people are fit and functionally well and able to cope with treatments. So lung cancer may be a referral that is made just because somebody was concerned because of red flags, or it can be an incidental finding. So one might pick up a nodule or a lump or something on a scan for some other reason. So somebody might see a gastroenterologist or someone else and they have a whole screening scan of the body and find something. That's how the referral gets done. Or it can be done as part of the screening programs. Now, anything that is a low stage cancer is a very important thing because the prompt diagnosis with treatment leads to cure, which is the ultimate aim of all of us. So what would one do if you're referred? So should any of these pathways result in a referral for a concern about it, remember, there are nodules that are completely benign and may not be cancerous at all. There might be many things that are not cancer. The more referrals are made for this condition, the more early ones we pick, but we throw out a lot of ones that are not cancer. So not every lump is a cancer. So once that referral comes, we would promptly, or I would promptly, get your history, your background, risk factors, function, how good and fit and everything you are, and then your examination, and then your tests. So scan, some breath function tests, lung function tests, just to assess how good your lungs are and what they can cope with, and some bloods. And then we move on to a biopsy, and the biopsy would be dependent on where it is. And often a biopsy is preceded by something called a PET scan. A PET scan is a scan where a patient is given sugar or radioactive labeled or radio labeled glucose, and that goes into the body, and anything that is rapidly dividing like a cancer takes up the stuff, and then we can see where it is, how active it is, and how if it's spread anywhere. And once we've got that and the biopsy, it enables one to find out what type of cancer we're dealing with. There are now multiple genetic markers that one has that you can get either out of your blood itself or from the biopsy that enables targeted personalized treatment of patients, and that enables reduced side effects and much better outcomes, aiming really to achieve cure or lack of progression in the cancer. this is once we've got all of these investigations together, we discuss, all patients are discussed at something called a multidisciplinary meeting, where there's a surgeon and an oncologist and a pathologist and a radiologist and respiratory consultants like me, where staging and the correct treatment is decided on patients, and then an appropriate specialist, whether it's a surgeon or an oncologist, provides treatment so that we achieve either cure or reduction or stability, which is the aim. But most of the time, the aim is really cure. So the earlier one sees patients, the better. And that's when I would be very keen to see any patient with a concern or where this has been suggested, and the objective has to be to do it as quickly as possible, both to enable good quality outcomes and reduced anxiety, because it's a diagnosis one doesn't want to go through, but it's so important that clinicians, whoever it is, supports a patient to get through this process as quickly as possible with the best possible outcome.